All right, before we get too deep into anything, there's one very important thing I forgot to cover about iontophoresis. What's the problem? What's the thing we're a little worried about with iontophoresis? Why is it the first electrical stim that we've talked about that has this unique characteristic that makes it more dangerous than the others? The risk of burn, drug allergies, and why is the risk of burn higher with iontophoresis than the other modalities? The chemical buildup, and why do we have a risk of that chemical buildup? Because it's direct current and not alternating current. So when we use iontophoresis, everybody make sure we write this down and put it in deep in our brains, not deep in your brains, in the front of your brains. When we apply a modality, how frequently would we check in on the patient? Give me some modalities. So it was every 5 minutes for our hot and cold, right? For iontophoresis, we want it to be every 3 to 5 minutes. Now, some of the trouble with that is, especially these pads are stuck onto the patient, so we're going to have trouble visualizing to some degree, but we can examine the skin around the pads. And if we felt like we needed to, we could put pause on the unit and then check underneath the skin as well. So if you did have a worry about that, but it should be every 3 to 5 minutes. Now, if we've got 4 milliamps being input into the patient, that means how many times do we have to check on the patient during that? It's going to take how long? 10 minutes to get to 40 milliamp minutes. How often do we have to check on the patient for that one treatment? Yeah, 2 to 3 times. It's every 3 minutes. Do it 3 times, you got it 9 minutes. There you go. Every 5 minutes, 2 times. Great. If we only have 2 milliamps, if they can say, it's feeling a little weird, turn it down. We only get to 2 milliamps. How long of a treatment time does that take? 20 minutes. And now we still have to check every 3 to 5 minutes. So we're checking them all the time, but we have to, because has that risk of that ion buildup underneath the skin, because it is a direct current. I've seen it happen once. I've used Ionto maybe 50 times in my career, 50 patients in my career. Those patients would have it 5 or 6 times. So of all of those times I've personally used it, I've seen it happen once. So alternating current, yeah, everything that we've talked about so far. I think I'm 95% sure no others, right? Yes, tough questions like that. I think that's the only one we've talked about, direct current. Well, pulse has to do with, so direct current versus alternating current is whether the current is positive or negative. And we can have constant kind of flow, or we can have pulse.
Okay, so it could be direct.
Or that would be alternating pulsed as well. So it has to do with the time the machine is on or off is pulsed. This is the current is either positive or negative. Okay.
So direct current, positive or negative, the whole time.
Yeah, you're right. I didn't show direct. Yeah, that's it. It's one of those two. It's either positive or negative the entire time. It switches back and forth. Yeah. What's that? No, it stays positive or negative. If it's direct current, it's always positive or always negative.
Anode. Okay, a positive ion is a cation. But the positive electrode is an anode. And a negative ion is an anion, but a negative electrode is a cathode. It's kind of tricky.
Yeah, that was me. I named it all. Yeah, I did. I said, hey, Newton, Tesla, come here. I want to talk to you guys. I really want to screw with some people here. I also am the one who decided that bi-weekly means every other week as well as twice a week. That was also me. Yeah. So you're welcome for that. All right. So everybody make sure we underline Ionto, how frequent the skin checks, 3 to 5 minutes. And that's because it's a direct current. All right. The last thing I realized leaving yesterday, everybody played with combo ultrasound. Remember that way back, like feels like forever ago, but it was just like 3 weeks ago. So everybody played with combo ultrasound. But then I forgot to like actually talk about combo ultrasound and practice it again. So we'll do that today. So combo ultrasound, there's not much to talk about with it. The ultrasound head delivers the electrical stimulation in addition to ultrasound waves. The best use I have for this is muscle spasm. And one of the other great benefits of combo ultrasound is the accommodation is minimal. I think if you can remember way back when we were doing it, how you could feel that electrical current moving underneath of the ultrasound head. Well, because of that movement and because of the slight variation in resistance of the skin, there's no accommodation. It's a lot different than sitting with the TENS unit on and saying, okay, after about 10 minutes, I don't really feel it that bad. Or even with our Russian and VMS biphasic for muscle strengthening. How many people after the first couple reps were awful, I hate it. But then after 5 or 6 reps of that, you go, all right, I mean, it's still tough, but it's not that awful feeling. Anybody feel that? Everybody stopped after 2 reps. The initial shock, and then it kind of say, okay, it's uncomfortable, but it's not terrible. Maybe. Brian's over there going like, I never got to that point where it didn't suck. So you can use a variety of e-stims with it. Again, my job I feel like my job is to teach you the fundamentals that I can, make sure you guys understand that there's way more you can learn about all these different e-stims, and really anything in physical therapy you can learn more about. Teach you the fundamentals, teach you the basics, expose you to the possibilities. So in our demonstration, we use pre-mod. I think pre-mod's really simple. It's only 2 pads. You could use it with IFC or other types of e-stims as well. To keep things simple, we use pre-mod just because it's 1 channel, 1 other pad, we're good to go. So dispersive pad placed away from the treatment area. And then the tricky thing for us was setting the e-stim and then the ultrasound settings individually. If you guys remember how to go back and forth between that while keeping your ultrasound head moving. So I think that's the physical skill that we need to develop. Keep doing this wah, wah, wah thing as you're playing with the buttons. That's probably the more challenging thing. And then, I mean, here's our parameters for both pre-mod for pain relief, as well as our, if you can remember way back to our ultrasound parameters too, there's our ultrasound parameters. All right, any questions on that? Yep. All right,